Hi, my name is Kelvin Sikwibele. I'm a Zambian living in Zambia and the CEO for IHM Southern Africa. IHM is headquartered in Zambia but operates across Zambia, Lesotho, Eswatini, and South Africa, and looking to expand into Malawi, Namibia, and other Southern African countries in the near future. We've been in existence for over a decade, working in the field of health information systems and specializing in the development and deployment of electronic health record systems, also known as EHRs. We work in tandem with relevant ministries of health and donors to develop, deploy, and support the implementation of these solutions, giving relevant stakeholders valuable and actionable information.
Our flagship system, SmartCare, is deployed across 1,531 health facilities in Zambia. It is well beyond a pilot and has taken us over 5 years to get to where we are today. It is built largely around preferred HIV/AIDS stated requirements, but with the help of new donors recently coming on board, we are gradually expanding these to cover the full spectrum of health services received at a health facility so that there is no need for duplicate data systems and duplicate data entry. This, of course, is welcome as it will ease the adoption at a facility level. The challenges we have is around the heavy cost of infrastructure management, connectivity, and cybersecurity. All data speaks to a central data warehouse sitting at servers in Lusaka. This brings with it a very high server capital expenditure, which get outdated very quickly, as well as ongoing maintenance cost. Cybersecurity is always a risk, both in terms of corruption of the data as well as extracting information for nefarious purposes. It is not uncommon for us to deal with 170 cyber attacks in a single month. Even with the cloud solution, the high server hosting and management cost remain an issue, and all the drawbacks around security and privacy remain in place. We are looking for most sustainable solutions.
So the truth is, although our company has over 50 staff members ranging in specialization from public health specialists to software developers to data analysts to M&E specialists, we really have no clue about blockchain technology. Some of us have been investigating it a bit and know just enough to understand the massive potential of it and how it can really revolutionize the development sector, but we really do not have this expertise in-house. We do see a vision where children's inoculation records can be maintained on a blockchain, where patients are the owners of their data and through smart contracts can grant healthcare providers access to modifying these records, but ownership of the records then goes back to the individuals upon the completion of service provision. We see a system that is safe from any sort of cyber attacks due to its distributed nature, but we have more questions than answers. We need UNICEF to help us fund a feasibility study that will lead right into a pilot focusing on urban populations where smartphones are prevalent. We therefore need individuals with hefty blockchain expertise to help us think through what the architecture should look like. Should it be a public chain, a private chain? Should we leverage an existing chain such as the internet computer, which is all open source? Or does our use case require us to set up our own chain? How would the tokenomics work to ensure individuals are benefiting? And how can it actually be leveraged in such a way that it incentivizes interaction with healthcare providers? Can patients earn tokens each time they receive a service? Can healthcare providers earn tokens each time they provide a service? Who should store the distributed ledger, and what tokenomics would we put in place to incentivize these individuals to provide their computing power? We have the information systems knowledge. We have a working system, fully deployed, built completely on open source coding, and we are working on putting the entirety of it on GitHub. But we need blockchain experts to come in and advise us on the correct design and then help us through the implementation of this pilot. That is why we were so excited when we saw this UNICEF opportunity pitched specifically at early stage projects and thought this is a once-in-a-lifetime opportunity to revolutionize the development sector. We ask UNICEF to partner with us, help us achieve this vision, and therefore impact the lives of millions of children in the developing world and the public at large.